Okay, let's jump right into this explainer. Today, we're uncovering how natural compounds and repurposed drugs are completely changing the landscape of oncology. We're looking at a really fascinating intersection where ancient botanical knowledge meets cutting-edge molecular science. Now, I know it sounds like a massive claim, right? But we're going to dive into the hard, peer-reviewed science behind how elements sitting in your pantry right this second, especially things like everyday cinnamon, actually interact with malignancies on a molecular level. We're skipping the folklore today and looking directly at the cellular mechanisms.
Section 1. Nature's Anti-Cancer Arsenal.
Let's focus on something you probably sprinkle on your oatmeal: cinnamon. Familiar spices like this are packed with highly active polyphenols, and specifically compounds called cinnamaldehydes. There's one in particular, 2-hydroxycinnamaldehyde, and in the lab, this stuff doesn't just have a mild effect, it's demonstrated the ability to strongly inhibit the growth of 29 different kinds of human cancer cells in vitro. 29! And it doesn't stop there. In preclinical in vivo models, it actually stopped melanoma and human tumor xenograft growth, specifically SW620 tumors. The best part? It did all this without causing toxicity or weight loss in the subjects. Basically, it actively works by inhibiting an enzyme called farnesyl protein transferase, which essentially blocks the signaling pathways that tumors use to grow so rapidly.
Section 2. Targeting cancer stem cells.
To really grasp how this works, we have to talk about cancer stem cells, or CSCs. Think of cancer like a really stubborn, invasive weed in your garden. Standard therapies, like certain chemotherapies, well, they often just cut that weed right at the surface. They do a great job shrinking the bulk of the tumor, but they leave the root totally intact. And that root is the cancer stem cell. It has this incredible capacity to renew itself, making it responsible for therapy resistance and the tumor eventually coming back. But phytochemicals, like those cinnamaldehydes we just talked about, uniquely target these root-like stem cells. They literally interfere with the cell's intrinsic survival pathways to stop the cancer from ever growing back.
Section 3. Mechanisms of tumor destruction.
And this multi-targeted destruction isn't just limited to cinnamon. We see similar, incredibly powerful mechanisms in garlic. When you crush a clove of garlic, an enzyme rapidly creates compounds like allicin, diallyl sulfide, and diallyl trisulfide. Now, these aren't just your run-of-the-mill antioxidants. They actively disrupt cellular growth signals and stop metastasis in its tracks. For example, diallyl trisulfide, or DATS, directly inhibits VEGF. That's a protein cancers use to build brand new blood vessels for themselves. So by blocking VEGF, the compound essentially starves the tumor to death.
When we expand our view to other powerful botanicals, the main takeaway you need to remember is that this isn't magic, it's just pure chemistry. While standard drugs typically target just one single cancer pathway, natural compounds are multi-targeted, exactly like our cinnamon example. Take curcumin from turmeric, for instance. It has the staggering ability to block over 80 cancer-linked signaling pathways all at once, triggering apoptosis, which is just programmed cell death without harming your normal healthy cells. Then you have green tea catechins completely derailing a cancer cell's plan for limitless growth, and amla extract directly halting the cell's division and replication cycles.
Section 4. The bioavailability bottleneck.
But, okay, here's the major plot twist in our explainer. If this stuff is so great, why isn't it everywhere in clinics? Well, we face a massive hurdle in natural oncology called first-pass metabolism. Let's go back to those powerful polyphenols in cinnamon, or curcumin from turmeric. When you take them orally, they go straight to the liver for extensive first-pass metabolism. The liver spots these compounds and rapidly breaks them down, conjugating them into glucuronides and sulfates, which basically just means it eliminates them super fast. Because of this rapid clearance, studies show that less than 1% of the free active compound actually makes it into your systemic circulation to fight the tumor. Just 1%. And unfortunately, you can't just swallow massive handfuls of cinnamon or turmeric powder to fix this. Our bodies have a general linear bioavailability limit. For most natural phenolic compounds, your absorption is strictly capped. Taking extremely high doses, pretty much anything over 1.8 grams a day of a single compound, just gives you diminishing returns. Your GI tract can only absorb so much at once, and honestly, taking massive doses can even alter your beneficial metabolism, or just cause some serious stomach upset.
Section 5. Enhancing absorption and delivery.
Thankfully, nature actually provides its own clever workarounds through dietary synergy. Combining cinnamon with black pepper is a perfect example of this. Black pepper contains a highly bioactive compound called piperine, And piperine is a remarkable bioavailability enhancer because it essentially acts as a temporary roadblock for the liver enzymes that usually clear out those polyphenols. So, when you combine piperine with compounds like curcumin or the cinnamaldehydes in cinnamon, you dramatically increase the amount of time they stay active in your bloodstream, giving them a real chance to actually reach the target tissue.
But we're also going way beyond natural dietary synergy now. Clinical researchers are heavily utilizing modern drug delivery systems to solve this. By using nanotechnology, like literally encapsulating these botanical compounds inside microscopic liposomes or solid lipid nanoparticles, scientists can protect the bioactives from being destroyed in the gut and the liver. Think of this encapsulation like a microscopic Trojan horse. It dramatically improves systemic absorption, sneaking that cancer-fighting chemistry right past the body's defenses and delivering it straight to the tumor site.
Section 6. Clinical Evidence and Future. So, what does this actually look like for real patient outcomes? Well, it brings us to the exciting realm of repurposed drugs, specifically things like ivermectin and mebendazole. Structurally and functionally, these act a lot like the multi-targeted cinnamaldehydes we explored earlier, but with one massive, game-changing advantage. They already possess excellent tissue penetration and bioavailability. They don't suffer from that severe first-pass metabolism bottleneck, which allows them to efficiently target those cancer stem cells and disrupt tumor growth right out of the gate. And the clinical data we're seeing is highly compelling. In a recent prospective observational cohort of 197 cancer patients who were prescribed this combination via telemedicine, an incredible 84.4% reported a clinical benefit at the 6-month mark. Even more astounding, almost half of them, 48.4%, reported actual tumor regression or no evidence of disease. Patient adherence was massive, sitting at nearly 87%, and the side effects were predominantly mild and GI-related. This is a huge deal because it proves that targeting diverse biological pathways, the exact same strategy used by the compounds in cinnamon, is highly tolerated and incredibly effective in human patients. So, I want to leave you with this final thought to chew on today. We've seen how the molecular brilliance of everyday spices like cinnamon can actively target and destroy cancer stem cells. And we've seen how solving the bioavailability bottleneck, whether that's with clever nanotech or repurposed drugs, is yielding some truly incredible clinical results. As we finally overcome these long-standing barriers of absorption, we just might be unlocking a totally new, highly integrative, and incredibly effective era of oncology. Thanks for joining me on this explainer today. Keep questioning the science and keep learning.